A very good morning to you. I do hope that you're fine. Today we want to look at our second topic, that is counseling in family planning. I know you've come across the term counseling. Remember, in your first semester, you did a unit called guidance and counseling, and I know that you got a few tips. Not to expect you got a few counseling skills that there's actually not a few counseling skills that are expected of you, the profession, and maybe you are acquainted to some of the models that can be used in terms of counseling. Usually counseling will take shape depending on the context, that is the situations. So we have it that now as for family planning, we need to understand that it is paramount importance to assist women and their partners to have more control over their reproductive health. You as a health professional, it's important. It's like expected of you because you're the one who has knowledge to assist women and their partners on how they can be able to have more control over their reproductive health. So one of the ways of achieving this is through family planning counseling during the antenatal period. Do you know the difference between antenatal and postnatal or postpartum period? I hope you know. Maybe you'll tell me in the class. So during the antenatal period and also postpartum period and any other time that they may seek the services, to do, give them what is right, give them right information, because sometimes most people have fallacies. They have information that is not true about even the different forms of contraceptives that are available, the different modes of family planning. If they are able to make an informed choice, they are more likely to be satisfied with the method chosen, and they'll be able to continue with its use, thus promoting effectiveness. The advice of FADA is often instrumental in helping the people make decisions concerning their future. There is need for systematic interventions to remove myths and demystify wrong beliefs concerning family planning. It is important to identify socio-cultural beliefs and practices that hinder utilization of family planning services. So that is our introduction to this topic. The objectives are that by the end of this topic, you should be able to discuss the importance of counseling and family planning and clients' rights. You should also be able to explain the qualities of good family planning and counseling. Also, you should be able to explain the steps used in counseling a family planning client. And lastly, you should be able to discuss the client assessment prior to administration of the method. What is family planning? What is counseling in terms of family planning? We come across that? Yes, we can know more about it. Counseling in family planning is viewed as an art whereby a service provider guides a client to make an informed choice as far as their reproductive health needs are concerned. So it's not a science, but it's an art. Why? Because it will involve skills. It will involve you guiding this relevant information within so that they can be able to make informed choices. You're giving them facts about different modes of family planning. It's an art where the service provider guides a client. You only guide, you don't force. Haushtumu na haulazimishi, hautishi, only guide a client to make an informed choice as their reproductive health needs are concerned. So a client's choice of contraceptive method involves factors such as efficacy, safety, and contraceptive benefits, cost, and personal considerations. So always allow the client to make choices by her, maybe you together with a partner. So at the end of the day, because it's effective for her, the method is safe, the efficient, efficacy, and also the necessary. So it is the vital part of family planning, and the issues discussed in family planning is a very important part of and use the chosen method safely and effectively. Or else when you force them, may help you, but they may not use effectively, especially like maybe the use of the pills and supports needs memory, the withdrawal method, and such. We shall have a look at them, both the advantages and the disadvantages. So to be effective, counseling must be based on the establishment of trust and respect between the client and the counselor. So in terms of effectiveness, for counseling to be very effective, we are saying that there has to be what? An establishment of what? Trust and respect between the two, the client and the counselor. The counselor has to prove trustworthy to his client, or he has to help this client this counselor is confidential. Is respect that you won't hear this information all over in the hospital setup, amongst friends or somewhere else, you know. This learning-oriented process should be in an interactive relationship where the helper should express care and concern in helping the learner to make proper decisions, the learner or the client to make proper. So always ensure that you are in such a relationship with this client that you are interactive, you are able to express concern and care, because every human being needs this. Because, you know, when it comes to decisions, we have a myriad number of decisions to make in life, and sometimes people are at the crossroads. So basically, in terms of family planning counseling, we need to offer guidance, assistance, support, advice, and also help at the same time. So what are the qualities of a good counselor in family planning? Of course, when you look at guidance and counseling, we came across qualities of a counselor. Can you remember any one of them? Do you remember any? Just name for me at least 5. Kindly for me during our class, any 5 qualities. So here for proper counseling deals with proper counseling deals with ethical understanding, legal responsibilities, and moral obligations. Like every other time you offer counseling to people, it needs ethical understanding. Ethical is what is ethically acceptable, what is acceptable within given cultures or within given setups, or wholesomely within the world, what is globally acceptable. You know, ethically understanding. We need to have the ethical understanding. Legal responsibilities, knowing that whatever advice you are going to give, if you're going to mislead this patient, if you're going to offer to the health of this person, then it has some legal consequences. The client can decide to sue you, and you'll have to answer to a case in a court of law. Then we have moral obligations, like we need to take care of the issues of care and concern, like in terms of being trustworthy, being dependable, you know, so that objective in all that you do. So counseling takes place in a world of reality where people are required to make ethical choices and decisions. Sticking to professional ethical requirements is key, and a good counselor wants to understand, and respect the client's practice. And every other time you go to that doctor, as you reach out for any form of help in this world, or as you exist, do you know your rights? So you have that every client has a right or has rights. It is one of the most important human attitudes required. Uh, it normally begins with respecting oneself, and so that others can also respect you in turn. It is having good intention, warm regard of clients, respect the client, avoid imposing your values on them. Avoid judgments. Many times you find that respect the man supporting each one's search for him or herself, and structuring the counseling to the needs, capacities, and resources of the individual client. So we have to intentionally to be the clients to be good, to avoid being judgmental and making conclusions that could and not be measuring up and even distorting their lives. So the counselor needs to ensure that the client accepts the problem and the solution at his or her own. Counselor needs to ensure that what the client accepts what problem, that here is the situation, this is my issue, and here is the solution, and I'm the one who is supposed to go through this and come up with a solution and work it out. So the counselor is just to guide through. The second quality of a good family planning counselor is that they should earn the client's trust, and this reflects honesty, transparency, and also trust, as in aspect of confidentiality, you know. So this element is basic to a counseling relationship. It's basic to any form of counseling relationship. So family counseling is not. So there has to be an aspect of honesty. Whatever things you share with this person, you have to be honest, and you have to allow honesty to happen. You have to be transparent with the information and let the person be transparent. And at the end of the day, you will interact. But to establish communication and respect and gradually be lost. The third quality is that a good counselor would understand the benefit and limitations of contraceptive. That by then this course, when the semester comes to an end, you should have known all the contraceptive methods that are present here in the world or in Kenya, and all the benefits, advantages, limitations, or disadvantages, so that as you have those ones at the tips of your you're able to disseminate the right information to your clients and help them out in case they need information of clarity or anything in line with this. Another is that he or she understands the cultural and emotional factors that affect our clients or a couple's decision to use a particular contraceptive method. So here we find that there is need for systematic intervention to remove the myths, the mystics, and wrong beliefs. It's important to identify social cultural beliefs, factors that hinder utilization of planning methods. We need also to try to communicate, understanding, or expressing the message. I find that for them, they would want to accept that tuliumbwa na Mungu tuzae, we have to be here and feel the universe. So their role is just procreation, but you see, we have to give that children and we to be able to take care of everything, basic needs, in order to be able to educate comfortably, you know, the one you can be able to take care of all the physical, emotional, social needs, you know. So we have to identify any beliefs that are wrong beliefs that are with people. So that believe that when you start maybe planning, you never give birth again. So the main issues, and with that, you find that it goes to other sectors like even supplementation, food vitamin A. There's a time of doing mass supplementation. We have the micronutrients that are common, especially like in Kenya. We have vitamin A, we have iron deficiency, we have iron among others. So when the remember to in capsules, as it was being issued, the vitamins to be issued to given children below the age and also for us to happen. The men in this community stop the process. They have to leave those people who are told them that they know what they're doing, like they're bringing family planning to those. I mean, it's just a form of planning to win and they want for it. So sometimes you find that because of these wrong beliefs, as they infiltrate through the communities, have wrong perceptions, could be beneficial to the entire community of the lives of the people. So it is important to encourages the client to ask questions, as it helps to get the client's viewpoint and provide clarification where needed. So just give information, don't just give a talk and that is, a good family plan counselor. Encourage the client to ask questions. Like maybe you're talking about the modern family planning methods or the contraceptives. After you've talked about each one of them and their benefits, allow this person questions. Or probably as you introduce the concept of contraceptives, let these people talk about what they believe they have as beliefs about contraception, about family planning. Let us speak out. From there, you know how to go about helping and guiding. We say, want to help clients to have a responsible reproductive health, a good reproductive health. So another quality is that a good family planning uses non-judgmental approach, which shows the client respect and kindness. Here, remember again, if a client will come and say that he or she or they are not willing to start on contraceptives, especially the modern ones, allow them to speak out. Don't be judgmental. Maybe offer to them what could be more convenient for them. And maybe, as I've said, you need to ask questions. From there, you should be able to know why are they doing things the way they do, or why aren't they doing things the way they're supposed to do. So from there, it will make you not to have a judgmental approach, so that you don't just make conclusions unnecessarily of judge these people as they are. Probably they're misinformed, so you need to give them the right piece of information. So when you are not judgmental, we are saying that it shows the client respect and kindness. They'll go away appreciating and even preferring to come back to you next time so that you are for them. Then again, another quality, a good family planning counselor presents information in an unbiased, client-sensitive manner. You don't place the information in terms of maybe communities, in terms of tribe, in terms of gender, and such like. You try and really present this information in an unbiased manner. The client, because usually human beings, we are sensitive to information. Let the client be able to see this as a broad-based issue, not narrowing really down to a specific group of people or a specific tribe, or a specific whatever. Make it a bit unbiased and there. Another quality is that they actively listen to client concerns, and this one is effective listening, which is more complicated than own level of self-awareness, and also his or her awareness of the verbal and non-verbal cues of the person. Remember things that someone will verbalize and talk. Others, it will be through action, and shaking their head or sneering or looking away, non-verbal ways of communication. And this lead through the guidance and course. Now, we're saying that for this process to be effective, so that the counselor is able to actively listen to the client, that the counselor himself herself should be very much self-aware, should be able to know about herself or himself and have dealt with his or her own issues, but also being able to check on the issues of the other. So remember, we talked about the intrapersonal, interpersonal relationship issues. Now, also a counselor needs to be able to respond to the client in a way that he or she feels understood. And being a good listener, it entails receiving and sending appropriate messages. So you have to be a good listener. You have to be able to respond to the client in such a way that he or she will feel understood. You don't just forward. You don't appear as if you are judging. You don't talk as if, something that's obvious. You don't make this person belittled. You don't belittle the client. You don't make him feel inferior or her inferior. So you try to ensure that you give information, receive and send information with appropriate messages. So in counseling, it's important because it means meeting the needs of the client. You don't do that, you miss out on the same. So listening to the client is not just a matter of receiving what they say, but also noticing how they say it. So sometimes how they say it is much more revealing than what they actually say, which may be more concealing than revealing. So therefore, it is key to understand the effect of nonverbal communication. So every other time, please review your notes on guidance and counseling and try to ensure that you follow up on your client. So for you to be a good counselor, you need to use both the verbal and nonverbal cues. Then the last quality is that you should be able to recognize when he or she cannot sufficiently help a client and refer the client to someone who can. You see, we are not jack of all trades. We are not knowledgeable in everything, or we'll be knowledgeable, but you're not very good at it. And maybe there's a colleague of yours who's very good at something that you may not be 100% good at it. Maybe it's 95 or 90%. So we're saying that in case you happen to recognize that you cannot sufficiently help a client, a good quality of such a counselor should be that you should be able to recognize such and help clients by referring that same client to someone who can be. So it's always important to remember we talk about rights, and we say that every client has a right. So it's important to remember that clients have the right to decide whether or not to practice family planning. So you're not going to force them. Your role is to give them information, the right information, arm them with the right information so that they can make informed choices. So it is them who have rights to decide whether or not to practice family planning. If they choose not to, then it's upon them. Remember, your aim was to help them improve their reproductive health. Now, if it's such a state that they're not willing to do that, you can't force. Then also, their right to freely choose the method they want to use. You're not going to force them on any method. You're not going to lead them through a set method that you think or you feel is good. Much as you may think it's good, through what the knowledge that you have, always allow them to choose the method they want to use, given that provided you've given them the right information concerning all of the methods. The privacy and confidentiality, they have a right to that. So that in case you do anything against their privacy and trust, they are free to sue you in a court of law. They get the information somewhere in the media, on the social media, in the mainstream media, you'll be in for it, So you have to really ensure privacy and confidentiality in terms of the information they give to you. Then lastly, last but not least, the clients have a right to refuse any type of examination. You see, sometimes the tests that will be carried on this client, where we may know maybe if they have any reactions, any hormonal imbalances that will need addressing. So with all, they do have a right. If they say that they don't want to be examined, that is it. You can't force. Yeah. So all the clients have a responsibility to respect the counselors and the other staff, and also provide accurate information about ability and circumstances. Ask questions, pay bills, and be on not under the influence of alcohol or drugs when seeking services. So again, much as you as a country have your role to play, also the client have roles to play, in which you are saying that they have to respect the counselors and also any other staff that is attending to them. They are also supposed to provide accurate information according to ability and circumstances, also ask questions, pay bills, because all the services sometimes may need being paid for. They need to pay up for the bills and not they will never be under the influence of drugs or alcohol when they're seeking the services. Now we have several steps in counseling a client planning. How do you go about it? There are 6 major steps used in counseling family planning client or patient. I think patient here is not a very good. We can easily use clients because they're not sick. So they're based on the acronym GATHER. So the steps of counseling for family planning are based on the acronym GATHER. GATHER, GATHER, GATHER. So the GATHER approach has been commonly used in counseling for effective counseling process and to ensure that the clients are well taken care of in terms of all their needs, and you as the counselor, you are able to understand what actually this client needs. So with GATHER, it means that you first what? G means you greet. Then A, you ask. S, T, you tell. H, you help. E, you explain, and then add the plan, the visits. So maybe we shall look at each one of them. How to greet. So when you greet, you're going to greet, welcome, and make the client feel comfortable. So the first thing the client walks into your office, you're supposed to help the client feel very comfortable. As he or she walks into the office, you need to be there, watch him or they come in, the husband and the wife, or the couple. Then you greet them. How are you? If it's a morning, good morning. How are you? Welcome this morning to this my office, or to this hospital, or to this facility. You make them feel easy. If the weather has changed, talk about something general to help them relax. I tell them, now, like today it's a bit chilly. Today it's a bit chilly. Yeah, the weather has really changed. And we've just come from a time of getting roasted. Let them relax. That is what we call rapport. Rapport. R-A-P-O-P-P-O-R-T. Rapport. So we establish a good rapport with them, Ask them from where they've come from, if they're not from that region. Where do you come from? How is the place? Is it raining as here? Is it as sunny as here? Help the person get very comfortable. You look lovely. Welcome. Then ask the client about themselves and any family planning experiences. Get all the information about the patient. So now you establish a rapport, you've made the client feel very comfortable, then ask the person, what brings you here today? I want to get that because you come to a family planning clinic, you will need some of our family planning services. But before then, maybe tell me about your family planning journey. Let the person talk as you make your about this person. Get all the information about that person, like about the age, and what she has been able to do in the past, what worked and what has not worked. That's all the information that is relevant in line with family planning. Then tell the patient of the methods and reproductive choices. This is where we talked about one of the qualities of a good family planning counselor, to be knowledgeable, to have information on family planning as the thing, the advantages and disadvantages of all the family planning methods, so that you can be able to tell this patient, you can be able to explain them to this client, and as you do that, different choices, this patient or this client will be able to make informed choices. So after that, you help, and you're going to help patient make informed choices through history taking, general examination, and finding out the real needs. So you're going to do a lot of history take about the person. If probably she was on a certain contraceptive and it didn't work for her, try to find out how long ago was this, and if it didn't work, have you ever used any other method? Yes. And did it work? No. What happened? Were there miscarriages? Was there pregnancies? Then you do a general examination of the body of this person. We usually have the general examination. You can do a lab examination. You can do some examination of the body of this given person. Then find out the real need, like find out what this person really needs, what does she really require in terms of a family planning contraceptive method. Then explain in detail the method of choice and give detail on how to use the choice and give detailed instructions on how to use the method. So if she has chosen, for example, the family planning pill, you need to help this client know that this is what I've chosen, you chose them. We'll have to take it on a daily basis, same time. If you're taking it in the evening, take it every evening. If you're taking it at 10 every evening, take it at 10 every evening. If you're taking it 9 in the morning, take it every morning at 9 a.m. Mostly the injection is offered for 3 months. The strength of the medication, excuse me, goes for like 3 months. So like you get to return it that you need to come back on this date. Yeah. So come back again on this date. You give detailed information that given instruction. Then lastly, return visits, explain discussion, and encouraged. So ensure that you do return visits. You tell the person that I want to see after a month or after 2 weeks so that we see if there are any adverse effects on your body concerning this and this. So with that, the client will go away satisfied. And in case of any issues, they come back to you and you'll be able to attend to them. So all services, delivery points should be in a position to provide family planning services. For example, dispensary health centers, hospitals, private clinics, pharmacies, outreach services, and also mobile clinics. So any health service provider should be able to offer that for the different plans with different needs. Health providers such as doctors, nurses, clinical officers, pharmacists, community workers, and community-based distributors must be specifically trained for family planning. And that's what we're doing to you because you know you are going to be a community health worker or practitioner. So you're going to work in the community or in the hospital setup. You're going basically to interact with different people with different needs. Family planning, of which you said is an important concept of reproductive health. We'll have to address it. We'll have to talk about it. We'll be able to talk to parents about it, and you need to be informed. That's why we have to go to take you through this training on family planning. Okay. Next, I want us to look at the phases of counseling in family planning. Phases are just stages of counseling. So with counseling, we've already said that the qualities of a counselor. Assuming you've already qualified, you have the good qualities of a counselor. What about the phases? How do you go about it? Probably the approach we've talked about as most appropriate in terms of counseling. Now, with the phases, we do have a number of them, and the first one is initial counseling. And here, you do receive the client. That is all the method that is described, and the client is helped to choose the method appropriate for him or her. So that's like a first time visit, the first time contact with this client. So as you receive the client, you give all the forms of contraceptives or the planning methods available, and you let the person choose. So having informed choice, informed choice after getting the information. Next is method specific counseling. Now, prior to and immediately following service provision, that is, the client is given instructions on how to use the method, and common side effects are discussed and what should be done if they occur. For example, if it's like condom use, maybe the client has used the condom to demonstrate to the client on how to use the condom. And after that, let the client go away satisfied. If the pill card mentioned because it's the common one that women use, let them know that they have to take it every other time, you know. So this is prior to and immediately following the service provision. The third phase is follow-up handling, whereby now during the return visit, you use the method, satisfaction, and any problem that may have occurred as earlier discussed. And at this point again, follow-up, remember we talked about the other way you greet, ask, then you do what? You tell, you help. Then we also say you do what? You explain, then you return visits. So at this point in time, now after the patient, the client has gone, has used a contraceptive method maybe like for 2 weeks or for 1 month, and he or she has, they have returned, she has returned or they have returned as a couple, you are supposed to now assess the method in terms of how was it with them, you know, is it satisfactory, were there any side effects, is there any problem that occurred that needs to be attended to? Yeah. Then we have client assessment process. How do we assess the client? Because we say that sometimes we may need to do some assessment, including examination. But maybe before we look at the client assessment process itself, I would want to ask you, why would you assess a client in family planning? What are the reasons? So in a nutshell, we find that there are several reasons for assessing a client in family planning, and basically that to determine that the patient is not pregnant, also where any condition requiring additional care for a particular method exists. Also, you need to determine whether there are any special problems that require further assessment, treatment, or regular follow-up or referral, and lastly, whether there are need for HIV/AIDS services, and if so, to provide services or arrange the appropriate referral. So this usually can be accomplished by asking a few key questions. Remember when you talked about when you greet, then you ask, you need to find a lot of information about this person, about past health history and such. Unless specific problems are suspected, the safe provision of most contraceptive methods, except the IUCDs, that is the intrauterine contraceptive devices, are voluntary, and voluntary sterilization does not require performing a physical or pelvic examination. So you have to be careful with the questions you ask and remain attentive to the patient's concerns or the client's concerns. So furthermore, you need to clarify any points that you feel the patient does not understand clearly. So how reasonably sure would you be sure that a client is not pregnant? Well, you're likely to ask about any signs of pregnancy like breast tenderness or nausea. You should check out or ask for this client. They should not also have had sexual intercourse since her last menstrual period, has been correctly and consistently using another reliable contraceptive method, or the client within the first 7 days after the start of her menses, that is days 1 to 7, is within 4 weeks postpartum, and breastfeeding women, or is within the first 7 days of postpartum, or is fully breastfeeding and 6 months postpartum and has no menstrual bleeding. So if not sure and pregnancy test is not available, cancel the client, use barrier methods, or abstain from intercourse until her menses or pregnancy is confirmed. Of course, with pregnancy confirmation, we advise them to buy strips if it's a place where the pregnancy test cannot be run. Or they can go to pharmacies like in Kenya. Right now, most pharmacies that we have, most chemists do perform those pregnancy tests. It's just a basic urine test. Or they can walk to any health facility, public health facility, and have them confirmed. So that is it for today. And basically, I know by now you're able to explain some of the rights of the family planning client and factors that would affect family planning services. You are now able also to explain the qualities of a family planning counselor, but also some ways in which you can be able to reasonably confirm that a client is not pregnant before any form of family planning. Because remember, when you administer one, you get to So that is what we've covered today. We've looked at all these aspects in terms of cases. We've looked at the steps in counseling for a client with family planning. We've looked at the qualities of a good family planning counselor, and we've looked at why it's important counseling in terms of family planning. So if you have any questions, let me know as usual, and we can be able to discuss further on such issues that are arising concerning family planning. See you then.